Okay, welcome back everyone to another session with Fresh Dental Shadowing. Today we have Dr. Sean, and the floor is all yours.
Okay. Hey, everybody who's tuning in. My name is Dr. Sean. I was invited by Mona and everyone on the Fresh Dental Shadowing team to come and talk about, I guess, my experience as a general dentist. It's only been a couple years since graduation, but I'm hoping I have something to share with you guys for this presentation. I really love my job. I love general dentistry, and I think all of you who are pre-dental are going into a great field. And so we'll begin. Okay, so a little bit about myself. Actually, right here, the Golden Gate Bridge. So if you ever guys go to dental school in the Bay Area, this is actually what it looks like almost every day. It's beautiful. So that's why I put it up here. I love the Bay Area, and I also the Golden Gate Bridge is behind me. But yeah, I don't live there anymore. I live in LA. But going forward, that's me. I graduated Berkeley integrative biology major in 2015. I went straight into University of the Pacific Dugoni School of Dentistry. Graduated 2018. You'll notice that Pacific is a 3-year program. It's the only 3-year program in the United States. And right now, I've been in private practice for 2.5 years. So right out of graduation, I joined this moderately sized dental group and managed to buy my way in as partner. And now I'm at 2 locations. I work 3 days in one, 3 days in the other. Some fun facts. I lived in Singapore for 7 years, from age 3 to 10. I still have some family there. Also, my last name, fun fact, is I'm not Japanese. I'm actually Indonesian Chinese. So I speak Indonesian, Mandarin, and English and broken Spanish, which is very important. It's good to know your dental Spanish. Enjoy traveling a lot, as you know, I'm from all over. Used to be, figure skater, dedicated many years of my life to it. Still very thankful for the experience. I think it brought me a long way, including getting into schools and dental school. And I met my fiance during dental school. She actually graduated from UCSF last year, 2020. So she's a dentist now too. Going forward, okay, straight to the meat here. This is Berkeley. I graduated, like I said, in 2015. Mostly A's and B's. As you can see, I'm not a straight A student, and it was not a 4.0 student, but 3.53. With the DAT of 21. I think the averages for schools are going up. This is I took this test in 2013. Okay, so my recommendation, if you guys are taking the DAT and you want to apply straight into school, is you want to take the DAT the summer after sophomore year. Okay, that's the summer I took it, right after sophomore year, because if I had to retake the DAT, I would have time the summer of junior year before I applied again. Luckily, I was okay with that score, so I didn't retake it. But that's my recommendation. And then I do think it's very important to be well-rounded. So I did have a lot of extracurriculars, 3 years of wet lab experience. I did special needs teaching as I used to be a swimmer too when I was younger, and I taught special needs kids how to swim. Collegiate club sports, that's like I did ice skating in college also, and I competed with my college team. It was more of a fun thing to do, but still required some amount of time, but I think it's important to do what you love. And then also, you guys should look into, if you guys like music and going out and things like that, I was able to be a CPR responder at those events. So yeah, many things, like I got to listen to Sam Smith, Bastille, all those people all for free through these, events. Okay, so dental specific. I was involved in the pre-dental society for 3 years. The first year and second year, I was just a general member, but I did take part in a lot of events. Take advantage of your club events on campus, because the pre-dental society or pre-dental clubs of your college, they take a lot of time to organize community service events already for you. So make sure you take advantage of that, sign up for all these things, and make a lot of friends. and then track those hours. Okay, I had a spreadsheet where I marked down where I volunteered, tracked down the hours so that when dental application time comes, I knew how many hours I did. I knew what event I did. Made it very easy. Um, Also, in the summer before college, I enrolled in this dental assisting program. So I was able to get my registered dental assisting license during that time. And in my summers off school, I didn't take summer classes. I would just go back to my hometown and work as a dental assistant. And that counted as, my shadowing and assisting experience. Although I do have to say, even after all that assisting, I don't think I quite realized what dentistry was about. So I hope that this presentation will shed some light because it will be mind blowing your first year in dental school. Okay. Okay. Going forward is all right, dental school. Okay. To get in, they want you to be, man, they want you to be everyone. They want you to be everything. They want you to be nice. They want you to be talented. They want you to be smart and adapt and have conviction, resilience. It's kind of intimidating. There's a lot of things you got to do to get in. Um, I can tell, like pre-health people who are first years. We were also stressed out, so confused. Is dentistry the right thing for me to do? And my advice is, figure out if you can stand, teeth. If you like teeth, you think that's a good idea, and you want to help people. You like working with your hands, then you should explore that. And how do you navigate that as a pre-dent? Because this is a pre-dental conference, right? So I have this acronym. I'm sure some of you may have uh, recognized this, KISS. It just means keep it simple, stupid. Okay. So what does that mean? Just figure out what you like, you know, anything, what you like. Okay. Take a piece of paper, write it down, write down 2 or 3 things that you like, and you find a club that resonates with your like. Okay. And then you have to commit to it. As a student, you have to commit to it. Schools and even student interviewers, we like to see things at least, 1 year, like, you're only in college 4 years, so at least 1 year long. Um, and you need to be passionate about it. So, like in your interviews, when they ask you about it, you have to be able to talk about it. Okay. So for me, I mean, I already kind of highlighted what I like to talk about, what I like to do. My wet lab experience, that was with immunology labs for working with cancer cells and cell death. I was able to talk more of the nitty gritty technical science stuff. Upper right, that's my pre-dental society. All these people, they were able to organize such a big event to reach out, and that's what I like doing. Like community service and hanging out with friends that I met through my pre-dental club. And actually, everybody here in this picture has gone to dental school or already graduated. So, good for them also. And then lower left, the ice skating thing, I did that for maybe a good 9 or 8 years before college and kept it going because I like doing it. And then the concerts, I found a way to go to concerts while volunteering. You can do a mix of both, go for fun and go for volunteering. No one's doing that. And then make sure to have fun in college. These are my buddies on the bottom right during graduation. But guess what? In dental school, I don't think, dental school or dental interviews, your interviewer, they don't really talk about, they're not really asking you about like certain grades or certain things about, like, even if you're about dentistry, that's like, I would say 10% of their interview. Most of my interviews they were asking me about my ice skating. Uh, Interestingly enough, all I did was talk about skating because dental schools and dental interviewers and dentists want to look for something exciting or something that you're passionate about. So as long as you know how to, you can talk about it and you really love it, don't do it because someone told you, oh, you should join club so and so because it looks good in your application. No, don't do that. Only do it if you want to do it. Okay, and that's my rule. Okay, there's a little video of me before when I was younger. Yeah, so a little skating thing. So whenever, I'm sure if you can have some social media presence, that would help. I don't know if schools ever like YouTube me or look me up, but it's good to have something online. All right, but enough about that. All right. So we want to talk about dental school. Okay. Here's another thing. I went to UOP. When I applied to dental school, I had a notion where I felt like I had to get into a good school or like a good dental school, but also I felt like I just needed to get in anywhere. And actually, in my opinion, now as a working dentist, the latter is more true. So, meaning, I believe you should go to wherever school accepts you, wherever you want to be, meaning, like, let's say you got an interview in Florida and you got an interview on the West Coast and you felt more comfortable in Florida because you grew up there, go to Florida, that's fine. And the only thing I would say is if one school is substantially more expensive than the other, I would pick the cheaper school. Okay, unless the new school or the other school had no, they were newer and they have credentials or something like that, then be careful. But other than that, pick the cheapest school, pick where you want to go. If you think it's a once in a lifetime opportunity, like let's say you're from, Ohio, nothing wrong about Ohio, but like you get into UOP and you're like, wow, this could be my one chance to live in San Francisco in downtown and go to UOP, the best school on earth. Then yeah, you should go to UOP. But UOP is super expensive. So, um, like I was telling the coordinators before, you guys will be okay. There's a big student loan debt, but this is a high income job. It's pretty safe. So you'll be working, you'll have a job going forward the next 25, 30 years, no problem. So as long as you budget it right, the debt shouldn't be hard to pay off. Okay. So now like the money talk is out of the way and, you got into dental school. The other thing you want to think about is how long is the program? Okay. So this is simple. Most programs are 4. UOP is a 3-year program. I say more prime years. You can see there I said more prime year. What does it mean? It means that since you graduate a year earlier than everybody else, you have more years. You have 1 more year before retirement than everybody else. So the argument is if you're 64 and you're earning X amount of dollars, the extra year of working means that you can offset the high cost of the 3-year program because you're going to be earning more for 1 more year of working. Okay, which is nice to think about, but it's also very important. If it's out of your budget, don't risk it. And another thing about UOP is how confident are you in yourself and how good are you in didactics? Okay, if you are a whiz at school, like straight A's and, you've always been top of your class, yeah, sure, maybe you're up for it. But UOP, everyone I've met there are very smart and we are letter grade. So meaning every class has a grade from A to, F. And that makes it harder to specialize because every program is going to look at your GPA. Everybody is going to be looking at your class rank. And, you're going to be more stressed out because it's letter grade in 3 years. So I do say it's harder to specialize at UOP because one bad grade can knock you down versus other schools. A lot of other schools are pass, no pass. They may have pass with honors, but even so, that may not be a huge issue. I know UCSF is pass, no pass. I'm not sure about all the other West Coast schools, but I'm sure you guys in pre-dentals know more about it than me now. I'm already a couple years out. Okay. Yeah, specialty. So I mean, UOP alone, there is a multi-specialty in the house. Like we have an OS program that rotates in endo. Um, what else? But yeah, there's opportunity as a general dentist or like a DDS student to go into those programs and talk to the directors and shadow the programs after hours or like at night. They have night clinics. So there's opportunity to advance in certain skills, which I took advantage of because I knew I was going to be a general dentist. So I'd made sure to spend a little bit more time in oral surgery because early on, I really liked blood. I liked the surgery aspect of dentistry, so I knew I wanted to get into that. So I spent a lot of time there. And extracurriculars, I have to say at UOP, I did some community service, but the first year you're pretty much 8 a.m. to 9 p.m. At school, studying, practicing your preps on plastic teeth and things like that. So there's not much time, but you'll meet some special people in school who seem to be able to do everything. Um, I mean, in undergrad you meet those people too, but in dental school you'll meet a special breed of people who are able to do everything, and that's fine for them, but not me. Okay, so I didn't do much. All right, but moving on here. Okay, so now after school you got into dentistry, and this is specifically I'm talking about general dentistry. All right, so why is general dentistry so exciting? Okay, you'll notice I put down a lot of words here. The most number one thing that I say about general dentistry is the most important thing is patient relationships. I think that's the one specialty or one field of dentistry that we're able to build a relationship with patients, even more than like, I mean, I know periodontics, like people who deal with gum and bone, they do see patients over time, cleanings and, after surgeries and things like that. But the general dentist is the person who you're going to see um, for the rest of your life, provided they don't move. I'm sure you guys have stories about, you got into dental school and your dentist is excited for you. I have patients like that in my practice who are applying to dental school, and I'm really excited to them. And I even looked over a couple of their essays because I'm excited for them. But yeah, general dentistry is where you can really establish that, and it's fun. And you get to be what I call the quarterback of dentistry. You can choose to pass the ball to certain people you want. You can choose to run it, meaning do your own thing. Um, and you can see you do cleanings, extractions, implants, composites, which are fillings. There's gum grafting. All these things you can do as a general dentist. You just have to be willing to learn it, be willing to know what you can do, and also be willing to refer out. Because as you'll see some of my cases, it seems like um, I may not refer out, but I do refer quite a bit of cases because I know that the specialist can do a better job. And the most important thing for me is that my patients get the best care. So if I'm not able to do that for them, I will refer out unless they insist. They're like, no, Dr. Sean, I want you to do it. And I'll be like, okay, I'm probably going to regret this, but I'll do it for you. Okay. So that does happen time to time. Okay. Um, okay, this is not me on the right, but this little baby is just my representation of what dentists are graduating. There's a big world of dentistry out there, a big ocean. Um, I thought I knew, like, when I when I graduated, I was like, oh, I'm so good at extractions. I did like 70 extractions in school. That's like more than average. So, I thought I was good at extractions. I remember my first week of work. Like a tooth broke at the gum line, and I had to like dig in there. I had to use like the surgical a handpiece, flap it. It was a nightmare. I was sweating, and yeah, dentistry humbles you every day. Okay, so you can see here, graduation. Um, you think you know a lot, and the first 6 months, I mean, for me at least, it was very grueling. It was, in my opinion, it was kind of like hazing. Every case um, I had a really good mentor. So like every case I had, I would miss certain things. I would do some things different, and some things wouldn't work. Um, and so it was just crazy. But then as you get along, and after the first 6 months and first year, I would say you start being, in my opinion, more open to learn new things. So I was able to take more classes, learn from my own cases, learn from my mentors, and steadily I think I'm improving and I'm very comfortable. I'm enjoying dentistry. I love what I do, and I'm going to talk more about my cases. But yeah, so just be humble and be happy you graduated dental school at this point, but we really don't know anything. Okay. Next. Okay, so a typical days for me, at least, life as a general dentist is I see about 10 to 15 patients a day. I do see a mix of cash patients, PPO, which is private insurance, and Medi-Cal, which is Medicaid, so state insurance. Okay, and the both practices I run currently, I do my own cleanings. I don't have a hygienist. I previously did have a hygienist for 2 years, but because of COVID, we had to switch it up. And I actually find cleanings to be very good as a young dentist. There's no pressure during the cleaning visit. They're usually at least 20 to 30 minutes long. You get to work on the patient, and they're like, oh, his hands seem kind of like, very light, seems like a nice guy. And you start to find things, you start to see crowns and fillings that need replacement. And then you talk to the patient about it, you build that patient relationship, and they don't have to do that work that day, but at least you've got to meet them. They got to be seen by you, and they'll trust you, over time. So that's how you build it. And yeah, I also do root canals, and I'll have my occasional surgery or implant, and also Invisalign, which is something new that I've kind of dove into. Um, my first year, the first 6 months, I only did like 2 cases of Invisalign. The second year, I've only done like maybe 12 to 15. And then last year, I think I did like 50 cases. So it's been a very gratifying journey, Invisalign, because you get to move teeth and keep people's natural teeth. You're not shaving them down, for crowns or something, or you can move it, and people love you for it because it's so easy. So I'll explain more later on. Okay. All right. And next, okay. So a little bit of my progression as a new dentist. Like I said in the beginning, cleanings, exams, making sure I'm diagnosing correctly, because as a new grad, you might miss a lot. Meaning you might misdiagnose, or you underdiagnose, or things like that. Because like in school, you may be predisposed to treatment planning a certain way. Like when I was in school, a lot of my patients weren't able to afford crowns. There's Medicaid patients. Um, a lot of people didn't want to do work because if you're in dental school, most of the time, they either have a lot of time and they trust the system, or they may not have enough money to do work outside in private practice. So I was treatment planning a lot of very large fillings that wouldn't last a long time, because I was used to that in dental school. But once you're in the real world, um, you have to change your mindset. You have to treatment plan for your patients, to what you think is the best for them. Okay. And then if they can't afford it, then that's where like the treatment coordinator comes in and see if they can come up with a plan financially for them to achieve that goal. And maybe they could do certain things, like maybe the filling, but maybe have that as a backup plan. Okay. um, Next up was root canals. I actually wasn't allowed to do any um, kind of molar root canals when I first started out, um, as a new associate in the group, because in dental school, you're not going to get too much experience doing too many root canals. At least in my school, I did about 8 root canals total. Only one molar, because molars are exponentially harder. They're further back in the mouth, um, more canals, more complex anatomy. So usually dental students don't get to do those. So my mentor and boss told me, to start from the front. I did interior only. I got the basics down, and then I would go to the premolars, which is right behind the front teeth. And then as I got more comfortable, he actually took out a jar of teeth for me. They were all molars, and the time was slow. I would just like sit there and start accessing the molars. Like I would drill into the molars and open up the canals and like take a look at it, see how many canals are in teeth, and just that feedback from poking the tooth and opening up canals helped me build the confidence to actually start doing it on patients. And now I do molar root canals all the time. And wisdom teeth. That's also something I started off early. The Yeah, I was lucky to have a mentor that was able to guide me through that, because they're all the way in the back. But wisdom teeth are one of those things where I'll say more later on, where it's actually easy to progress, in my opinion. And then from there, after I did my molar root canals, I went on to implants. I placed my first implant, I think 6 months after graduating. Had a family friend, so that my mentor brought over, and we did an implant on her. Everything went well. I'll explain more later. I learned a lot from the case. And then now I'm more doing like multiple implants, and I'm doing like bigger grafting procedures, and I'm going more into Invisalign. I'll explain more again later. So this is an example of like when I first graduated. It was kind of nice. Like, I got reached out to on Instagram because I created my Instagram to kind of keep tally of all my cases, and all I did was just went back to my first few posts, to see what I was posting, and you can see like I was posting more like fillings, and I even I did this root canal too, but um, that's what you're going to be doing mostly as a new dentist, and even like stuff like this is so interesting. Like even the fact that I had a black, this is called rubber dam clam and black rubber dam. I got, I get excited over these things and they make my day interesting. So, I don't know if you know, I love dentistry and these things make me happy. And the fact that I can take a picture and it show the patient right here, this white part, that's a cavity underneath the tooth. And this is all of it cleaned out. We have a clamp here. And then this is like the etch solution where it helps the filling bind to the tooth, and then this is it finished. Um, and then I go back and look at my case, and I look at it, and it's not even now. It's not even perfect. Like, okay, maybe this is good, but like if you look at this filling right here, I mean, there's a little boxy here. I mean, will it kill the patient? Will it cause a problem for him? Maybe not. It won't. I mean, it'll cause a problem for my brain because I know I made like a little boxy angle there, but I could have smoothed that out a little more. Okay, so those are the things about like dentistry that it's an art form and you can always continue to improve, which is much which is what it makes it so exciting. Okay, and same thing here. Uh, I'm not excited about this root canal. I mean, it's fine. I did it did a good job. What I'm excited about is actually this thing on the X-ray. If you guys can see my cursor, that's the gum tissue. Okay, and the filling. I mean, the cavity is all the way deep in here. Okay, and because of Instagram, I was able to learn like many techniques where um, you can use, like, we call it a matrix, like it's a round matrix, but then we stuff another matrix in there, so it's like a matrix and a matrix, and I was able to wedge it all the way down there and get a nice seal. So those are the little things like about dentistry I enjoy. Not too much about the money because I remember this patient was a Medicaid patient, so reimbursement is not good. Took me like an hour to just do like this portion. So it's frustrating, but I like working on in small areas and very detailed situations. And teeth are tiny, but they're fun. Okay, what's going on here? Oh, and then this just happened last week. That's something, one of my goals, to get into more into cosmetic dentistry. I do think cosmetic dentistry is one of the hardest parts of general dentistry, because not only are you uh, working on someone's tooth, you're also working on most of the patients are looking for something to change, and they're spending a lot of money. So they want you to do a job well done. Um, and there's many ways you can do that. And there's many kinds of cosmetic dentistry you can become. The new wave of cosmetic dentistry is to be minimally invasive, meaning you'll start to see more veneers where they don't have to shave down anything, things like that. And that's the hard part. That's the really hard part. I mean, anybody can cut a crown, anybody can shave down the tooth and, do stuff like that. But the hard part is not shaving down anything and still delivering a fantastic result. So this is my patient. We'll just name him Bob. This is number 9. That's the front left tooth. Okay. He came in and you can see he chipped I think they were 10 years old, his veneers. Okay. These are conventional style veneers, meaning they reduced the tooth length. This is called the incisal edge. They reduced it, and then the veneer goes around the tooth and then up here. Okay, so he chipped it, and you can see his bite. You know how it's super worn down here. Um, so as a dentist, you don't go immediately like, oh, we just fix this veneer, like, and everything will be fine. You have to see why. I mean, he probably chipped it because there's something wrong with his bite. Okay, and I mean, I told him about his bite, but of course, in the real world, like, at least as a young dentist like me, I don't have 100% treatment plan acceptance rate, especially you're suggesting someone go under braces or Invisalign for another year or so to, really correct his bite. It can be a hard sell, but being a general dentist, I will see this guy over time, and I'm confident that he'll eventually get some sort of orthodontic work done. But let's move on with this. So he came in like that. I'm not done with his case, but This is what I have so far. We have this tooth. Before I took apart this temporary, I actually used a liquid composite. So it's like the white material for fillings. And I placed it over this tooth area, and I used his old veneer as like a template. So I filled it until it looked kind of like this, and then I cured it with no adhesive underneath. Then I took a mold of it, like a putty, so that I'm prepared for later on when I take this whole thing off, I can have a nice temporary. So since I didn't put any bonding underneath, I was able to just shave it off really fast. Um, and then this is the end result. This is temporaries only. This is not the real veneer, nothing like that. But patient was very happy with the veneer. He's quite demanding as a patient, um, but I'm hopeful he'll be happy. And the next thing, like, there's so many nuances of dentistry that you don't realize even as shadower or an assistant. There's just impossible. But all these shade guide photos, like the one I took in the beginning, right here, they're not taken after. You notice they're taken before, because what happens when you take it after is teeth get dehydrated. Okay, and when teeth are dehydrated, the shade of the teeth changes, and you don't want that. So you can see how I took this picture before. It's called 1M1, and I send this to the lab, and they also need to know what the shade is underneath. That's called stump shade. Okay, because now that they know this, when they create the veneer, they need to know how much translucency in the veneer is so that they can match the color without this brown area showing through, because this tooth underneath could be a whiter color. So that's the hard thing about cosmetic dentistry. I have a lot of respect for cosmetic dentists, especially those who do it really well. I'm nowhere close to that level, but again, something I want to explore. But this is a cool case that a general dentist could do, and it's fun. All right, next up, another thing general dentists can do, wisdom teeth extractions. And you'll have a lot of these, a lot of families. I've taken teeth out on the whole family, like three children. Like I took out one on the 17-year-old, and then she called her sister over who was 20, and then the other day they called over their brother who's 23. So I've taken out like 14 teeth in the whole family. I mean, so you'll see as a general dentist, if you can do it, people will bring you their children to do it. And what I mean by pick your battles, as a general dentist who wants to get into wisdom teeth, there are a couple ways you can be more, I guess, experienced with them. And it's not like you should go into wisdom teeth doing, like, I don't know if you guys know, like impacted teeth where the teeth are sideways and stuff. Yeah, that I wouldn't touch that first, but because as a general dentist, you have the ability to refer out at any time. So that's such a nice thing. If I don't want to deal with it, or that day, like I just don't think I'll have enough time, like in my schedule as a general dentist, to do a big procedure that will be like 2 hours long, and I know I don't have 100% success rate with that, I'll refer it. So same thing with wisdom teeth. Starting out, I only took teeth that were fully erupted, meaning they were straight up and down, and there was no bone covering it. Younger patient, because their bone is less dense. I would start from there. And as soon as I got more experience with that, then I went on to maybe partially impacted. So the teeth would be maybe partially sideways like this. And then once I got comfortable with that, I started doing more distal, it's called distal angular impactions, where they're more, the bone was, or the tooth would be going this way, and the bone would be covering the tooth in the back. And then so on and so forth. And finally now, if I feel like it, I'll do like complete boning where the tooth's just lying in here. It's nice to know I can do it, but it's also kind of like, if I don't really enjoy it, I won't do it. And I'm starting to not really enjoy doing complete bony, just because it does take a long time for me. I'm in there, I'm drilling a lot, and it doesn't really fit my schedule now, and it doesn't quite make sense financially for me to be doing them. But at least I know I can do it, and getting good at surgery makes you good at everything else, and getting good at cosmetic dentistry or fillings, even cleanings, will make you better in everything else. Just as long as you're very methodical and detailed, you'll be good. But why wisdom teeth extractions can be fun? It's because you can study them. So before you take out the tooth, you have to study the X-ray, and you got to look at this tooth and this tooth up here. So I knew going in 16, this is 16, we probably wouldn't have an issue because why? Number one, we have a pretty short root. And number two, the roots are going in like, a little teepee shape, so they're conical. So meaning when you can imagine it coming out, it'll come out easily. It comes out quick. All right. But the second tooth, when you look here, okay, you might want to be careful because right here you can see it, the tooth is curving in a little bit. And the second thing you want to look for is you guys see this dark shadow a little bit right here, okay? Versus there's no dark shadow here. When there's this dark shadow here, I've learned that actually the tooth curves on a 2D plane, but it also curves lingually, which means it curves towards the tongue and it embeds itself into the bone, the lingual bone. Okay, so what does that mean? It means that when you take this tooth out, you have to cut it in pieces because you don't want to just snap it out because this will snap right here. And then you're going to be digging for the tooth and it's not going to be fun. You're going to be sweating. And how do I know? Because I've been there. Okay, so I drew a little drawing here because I posted this on Instagram like 2 years ago. This keeps me accountable. It keeps me, helps me learn by helping me explain my thought process. But so number one, what I did was I cut this area out. Okay, why? Because there's bone over here. So when I cut this area out, it makes the room free to move more. So as I cut this area out, this tooth has a lot of room to move around. And that's all you want of the wisdom tooth. The more it moves, the easier it's going to get out. And the second thing I did was cut it, lengthwise like this. So now you have two independent pieces that have more room to move out. Okay, so by doing this, and since this area was missing, I was able to push the tooth out towards the distal, which distal means back of the tooth, out safely. And then now that this whole area is out, number three, it was very easy to flick out. Okay, and we can confirm my suspicions here. Look, it curved, and you can see how there's a shadow here. That means the root is a little bit raised, meaning this area was embedded into the bone near the tongue. So it's kind of good to learn about this in textbooks and stuff like that. And then as a dentist, you get to apply that and you get to confirm it. And as a general dentist, you're going to have a large body of work, provided that, every one of you eventually has your own practice. You'll have case studies going 20, 30 years, and you'll learn what works in your hands and what doesn't work. No matter what study, let's say some famous dentist does things a certain way and he has good success with it. We're only human, so we may not be able to replicate someone else's success. We have to figure out something that we can do safely, all right, and well. Okay. All right, and now we have, and this is another thing, CBCT, that's basically kind of a cone beam CAT scan that we have in our practices. Both practices have it. You'll notice in this X-ray before, this is a 2D image, so I can only see one plane. But now we have 3D imaging, so I can see multiple planes. I can see a lot of things happening in the tooth. So for example, that last wisdom tooth, I would have been able to see the curve for sure, from a cross-sectional view. This is from a top view. But yeah, 3D imaging has been great in my practice. It allows me to see a lot more. This patient came and she had a lot of pus and movement on this tooth. A little bit of pus on the gum area here, but once I took the X-ray, you can see that this infection is just everywhere. And even from the top view, you can see destruction of the bone just, surrounding both teeth. So I took out both teeth. I put some bone in there 2 weeks later. Basically you get the infection out first. You put them under antibiotics. You let the area granulate a little more, meaning it will kind of curdle up into like a booger-like consistency. And you come back 2 weeks later, you can scoop all that out again. And then you have a nice fresh socket where you can stuff bone in there. And you can see this is where I stuffed bone in there. This whole area was missing bone. I stuffed bone in here. And then I wrapped a little membrane, which is a piece of collagen that dissolves over time over here. So it keeps it nice and packed like a little sausage. And then I close it up. So hopefully with things like 3D imaging, you can also keep yourself accountable. Um, like for example, like, oh, I could have packed more bone here, but I know that because there's a blood clot in here, a bone will form regardless. So ideally, I would want bone here, but it'll be fine. But because of imaging like this, I can see where I could have improved on, and maybe next time I will, spend a little more time making sure every socket's filled. Something like that. Okay. This is another thing. This is my case. I already placed this 3 implants. I didn't show you guys the before, but on a 2D image, all you would have seen is this. And then we can see here, this is the sinus, this line, okay, right here also. So there's barely any bone here, actually. There's no bone here. Okay, this is the only areas that have bone. And I'm planning this guy for a denture because he can't wear a regular denture because he gags, so he just doesn't wear anything. He's a very low maintenance patient. He's very nice. So my plan for him is to make him like a U-shaped denture. So I'll show you what it looks like later. But back here. So I wanted to place one more implant here, but during the surgery, I noticed there wasn't enough bone. And you go back to the scan, and you can see this is the area I wanted to place the implant in, and there's only 4.5 millimeters for me to place an implant, and the narrowest implant I have is like 3.2, and you want at least, you're cutting it close, but you want at least like a millimeter or 2 millimeters on both sides of the implant. So I wasn't able, because we're not in a rush. I was like, you know what, why don't I go in there, put some bone and try to build more bone and then place the implant later, which is what I did. So I placed some bone, and this is like 4 months later, I assume. And you can see that we had, like the ridge you can see how it looks small and, thin. It does look a little thicker here. You can see more bone, more defined here. So I went in there and placed a new implant the other day, and I feel more confident the implant's going to last a lot longer. And you don't have this kind of technology without 3D scans. Okay, so this is a very important topic. When you guys are out of dental school, and even in dental school, you'll see more and more market penetration of this machines in the real world. So your office might have it, so use it. And this is the implant I placed. You can see I placed these free-handed. I don't know if you guys had speakers where they place them guided, where they'll print out a guide based on the scan, and they have like a intraoral scan with a scanner, which I also do have, but I didn't make a surgical guide for this. But a surgical guide is useful, so you can place the implant in the perfect position. But because I have a 3D scanner, I can visualize in my brain how I want the implant to go, and then plan my surgery that way. Which is why I think perceptual ability is very important as a dentist, and even in surgery. It has helped me a lot. As you can see, like I've placed the implant directly in the center. There's enough bone on both sides, because you could have placed the implant towards this way, you could have placed the implant this way, and you don't want that. Okay, so being good at perceptual ability, I played a lot of video games growing up. Maybe that helped me. I don't know. But yeah, this is fun. Okay. Oh, this is some bloody pics, guys. So this is the implant. I placed 3 of them for this guy. 1, 2, 3, and then the new implant I placed was down here. So my plan is they call them locators. So you can see in this picture, these are a little taller, but basically they would lock into an implant like that, and he would be able to wear the denture, and I would cut away this area that's on his palate so that he wouldn't gag. So his denture would only run like a U shape. Okay, and it'll be nice for him. He can finally wear something. He can finally talk and smile. Because I think now he doesn't care because everyone's wearing a mask. But I'm sure after COVID's all settled and safe, I want to be, make him happy, make him a denture. So it's one of my cases. Here's another one of my cases where having a good surgical base and just a skill as a general dentist, you can change people's lives. Like this is one of my patients. He's allowed me to post this picture. His dad actually helped us redo our front sign for one of the new offices that we're working that the group bought. And then he brought his son over, and this poor guy, he's only like 26 or 27, but he has diabetes, uncontrolled as people's health. Sometimes they let it go. And what happens with gum disease? All his teeth here, they were all moving. He was only 26. Okay, they were all moving. They had to go. There's no way you can keep them. So in one day, I took out all his teeth and gave him dentures. Okay, this is a denture. So look at him, nice guy, looks amazing now. He's super happy. Um, he's chewing, doing great and everything like that. And yeah, you can change people's lives as a general dentist. Okay. Going more into implants, yeah, going into my first implant, having good surgical foundation and also doing a lot of root canals and even simple root canals can help your implant skill. I think doing a lot of extractions and even root canals helps build um, kind of core foundations for your perceptual ability and placements of where you want to place the implant and just being more comfortable working in people's mouths. This is actually my first ever implant. There's a lot of things I would have done different now, but I still remember doing it. I placed it, and the whole buccal, which is the cheek side, the bone kind of like fractured off. Uh, I mean, she didn't have a lot of bone in that area. She was like my mentor's family friend. Um, but so she was really nice, but I was able to repair that area with like some bone and like membrane. And actually, I saw her 2 years later. The implant's still good, bone level is still good. So sometimes miracles do happen, even though all that happened to me. But because mistakes happen, you learn a lot and you don't make them again. Okay. And this is a implant I placed recently. When I first started placing implants in dental school, you're taught to place implants just a little bit below the bone. If that is straight, great, you did it. Okay. But as you get more advanced, you want to start seeing different things. Like I take these pictures so that I keep myself accountable where I can see the future crown is going to be right here, and you want to be slightly angled. You don't want to be too straight up. And then even here, the angle, towards the tongue and cheek side, that also matters because when the patient starts chewing, you want the force to go down straight down the implant, and that makes the screw not loose easily because like when it's straight up and down, implants do well. But if it's side to side, like if it's off to the side, you can loosen the implant. So all these things are very important, um, and I'm still learning. And even right here on these little marks, they're actually measurements of millimeter measurements, and you want to place your implant so there's enough gum tissue covering all the way up to here, about 4 millimeters, because the way your crown comes out is also very important. So what I'm trying to get at is, I mean, this is a lot of information, but general dentistry is so vast. There's so much to learn, so you'll never be bored. Okay. Advancing in implants. This is about after I place about 50 or so. You'll start to see I started working in a practice where the guy never did any implants, so he did a lot of bridges. It's human nature. People aren't. I don't know about you guys, but when I had braces, I never wore my rubber bands. Okay, I was just a bad patient. All right, but same thing with bridges. People aren't really gonna clean underneath their bridge. Okay, in my opinion, I've seen a lot of failing bridges. People are nowadays maybe they're gonna use their water pick more. That's great, but they don't clean under your bridge, so you'll start to have like gum infections. This is a combined root canal problem and gum problem. So like it was moving, there was pus. So in the same day, I removed the bridge, smooth out the bridge, and I placed 2 implants. Okay, then I replaced it with 2 implants right here, and now, she's never gonna get a cavity, uh, so she'll be fine. But that's something you can look for as a general dentist. You're gonna be replacing a lot of work that most likely people back in the day did a lot of bridges, but now in my opinion, standard of care is a single implant instead of a bridge. And then this is one of my bigger cases I did 6 months ago, and this lady came in. This is her 3D scan. You can see she has basically no bone. Uh, I remember doing her exam, and then when she came for a surgery day and we took the X-ray, I looked at her and I was like, why did I agree to do this case? Because I mean, it's just very advanced, and I'm my philosophy is like, if you don't have to stress yourself out, don't do it. But it's good to do. It's good to learn and good to apply certain concepts. So we can see here, this is a top-down view. She only had this much bone, uh, but how were we able to expand to this area? So you can actually, what you do is you make a little slit down the bone right here, and you insert these like titanium pluggers, like progressively increasing in size, and you wedge the bone apart. So you actually see it open up, and then you get to place the implants in here, and you pack the gaps from the slit in bone, and you just let it sit there, let it bake for 6 months or so. And this is 6 months later. You can see I had substantial increase in bone. I just recently finished a case yesterday. I should have posted the pictures, but I didn't. But yeah, you can do this as a general dentist. It's fun. I mean, I'm more surgically focused, but I'm sure you have you know, more speakers who do a lot more cosmetic dentistry, which is also crazy. But yeah, I find these really fun. The tactile, like dentistry is, there's a lot of tactile feedback. So you'll notice a lot of people enjoy taking out teeth, because when we're like using the elevator, which is the tool, when the tooth's ready to pop out, you'll actually feel like a little pop. And those little things make dentistry fun, in my opinion. Like when I place an implant in, there's like a certain amount of torque you want. So when I get the amount of torque that I want, I get really happy inside. So, you know, everyone's interesting. That also makes me tick. So I enjoy that. Okay, combining multiple treatment modalities. So I talked about dentures, I talked about extractions, I talked about implants, and where do I go from here? I had this lady, very, very nice lady. She came in with the teeth upper and from the upper teeth, and she said, Dr. Sean, I already know you're going to say like, blah, blah, blah. I want to save your teeth. Uh, but I don't want that. I just want dentures, you know. And normally that's a red flag. Okay, like you don't have to accept patients like that. You're gonna stress yourself out. And this is my rule too. So general dentist, you can go refer this patient to Prost, because that's a red flag. But when you take a look at her teeth and really evaluate each tooth, you can see that actually uh, removing all her teeth is not a bad idea, because this tooth right here and this tooth right here, they actually have decay to the gum line. These two teeth right here have already been redone 3 times, and there's only two near the gum line also. And this tooth is also broken. So you're talking about 1, 2, 3, 4, 5, and there's only 1, 2, 3 teeth that are remaining that are kind of solid. So I was like, you know what? No problem. I'm gonna do what you asked. And she was shocked. She was like, oh, okay, great. So what I did was I removed all the teeth, delivered the denture just like the guy before, but at the same time, I placed 4 implants. Okay, you'll start to see, not you'll start to see, but on Instagram, you'll see a lot of people actually loading the implants right away. So they'll actually have the little attachment, and the denture will fit on there right away. I'm not quite there yet. I mean, props to them. I'm not, I don't want to be, I say one miracle at a time. So I'm just going to leave these implants in there to heal. And then I also did bone grafting with PRF. That's something I learned last year, where I would draw blood from the patients. If you can do an injection in the mouth, you can draw blood. Okay, it's not that hard. We take the blood and we spin it with in a centrifuge. Okay, and then we mix the blood with the bone graft material, and it becomes like putty like steak like, and so it's able to stay in the sockets really well. And then you can also take some of like the fibrin clot, and you can squeeze it, and it becomes this little like tape like jelly material that you can drape over all these areas, and they help the soft tissue, which is the gums, heal very quickly. Okay, so that's something extra that I was able to learn. So that was fun. Okay, and then Invisalign. Uh, you know, like I say, patients are more likely to talk about a good Invisalign experience rather than good root canal extraction or implant, which is why I enjoy it, because you can change someone's life All they have to do is be compliant. I give them whitening gel at the same time so they can whiten their teeth. And you can see this is a nice result. The guy was super happy. Um, we have a 3D scanner. I know you had a orthodontist talk about that, so I didn't want to talk about too much, but it makes our life easy. You just scan, you can show them what their smile will look like with 3D modeling. They say yes, and then you and the patient will both be happy. Okay, so like that. Yeah, so I am a big believer in a quest for lifelong learning. Don't underestimate everything. Getting better at restorative, like fillings. Like today, I did a bunch of fillings. I still take my time. I still try to nitpick every single little thing, because I think having that attention to detail will get you better in everything else. So my advice for young practitioners and even like pre-dents, in school or whatever, even like things like working out or studying, like if you're getting good at something that you're working on improving, that's good. Don't look at someone else like, oh, so and so is doing, like uh veneers left and right, and I still can't do veneers. But then like be happy that you're good at doing fillings, be happy you're doing something, and then eventually you'll get there. Everyone has their own path. You see you're 1% better every day, it compounds. Okay, and like I say, general dentistry is endless. Okay, you can do anything you want. But the most important thing is you take care of your patients, and that's my number one goal. um, is to treat every single patient with respect, dignity, and I learn to listen. Now, reviews aren't everything, but I do ask for reviews. It does help. Okay, as a young guy, I'm the lead dentist at two places, so I need all the online backing I can get. Because like someone, I walk in and they're like, "Oh, are you in high school?" I don't know, but I don't get that anymore. But it does help to have an online presence. Everyone now, after 2 years, people are coming in because of my reviews. They come in, they're like, "Oh, Dr. Shaw, I read your reviews," or "Dr. Shaw, my friend referred you. They say you're a young guy, you do everything," or you'll take care of me. And I'm like, "Okay, yeah, I'll take care of you." And my number one goal is to make the patient happy and to listen to them. And if you listen to them and you treat their main concern and you do it in a respectful manner, you're gonna have happy patients. Okay, and with that, thank you guys, and don't hesitate to find me on Instagram. You can email me. I know as a pre-dental, I was scared to reach out to some people. Don't be, just reach out to me, and I can see how I can help you. Um, and yeah, that's it.
Okay, this was awesome. Since it's already 9, I'll just keep it short with the questions. We'll do like 2, 3 questions, and if y'all have any questions that weren't asked right now, you can probably just email him or DM him. Like he said, he's happy to answer. We'll take some questions from the live chat. One question was, have you ever had a case with an underbite, or did you find it difficult working with someone who had an underbite overbite?
Yes, actually, I've had one case with a mild overbite, underbite, but the cases with I only treat cases with Invisalign, and having the trays, the thickness of the material, it helps jump the gap. Meaning, like, because it's already dislodged, when the teeth move back, retract in, you can actually correct that. Um, but if you're treating underbites on adults, a lot of the time you're treating people who don't want to go through surgical manners. So a lot of people with underbites have to be corrected surgically. And if you already explain that to them and they don't want that, you can kind of mask it. They call it dentally. So you try to mask it dentally. Like they may end up edge to edge, or they may end up perfectly in occlusion. You don't know. But as long as you tell the patients up front that, hey, you might need surgery, and they don't really want to do that, you should be okay. Invisalign is an amazing product. Of course, you need to know the basics and you need to know how to treatment plan it, but it should be quite successful. Yeah.
Okay, and then another question from the chat was, what are the steps of becoming a cosmetic dentist?
Steps of being cosmetic dentist, I think number one most important is like you have a mentor that's really into cosmetic dentistry, because if you already have a practice that's built for that and a clientele and patients that are regularly doing that, and you're seeing veneers left and right, your growth is going to be just exponential. I know there's a dentist on Instagram, Dr. Matt Saro, graduated, and I saw, his practice was cosmetically inclined, and that's what he does. He also plays his implants, a good practitioner, but I think that does help. But like I said, start with, I wouldn't do veneer revision cases. Like, so you're revising someone's veneers, they probably have higher expectations. But, maybe if someone wants to do like two veneers, you do that. Or, if you start one at a time, just kind of like wisdom teeth, you start from the easier case forward. There's also courses that you can take um, directed for cosmetic dentistry. So that's another way. Mhm.
Okay, and then the last question, did you find the 3 years of dental school overwhelming in terms of pace?
Um, I think the first year is quite overwhelming in my opinion. The first 3 quarters are very tough. It helped that I lived close to the school. It helped that I live with roommates that are also, um, in the same class. Everyone gets through it together. That's why don't be a loner. Have friends. Very important, so that you guys are all in the same boat together. It's important to reach, do stuff that you like. I still went out. My friends and I still went out like every other Friday or every Friday, because like we felt like I don't know, you'll feel like you need it. Okay. And going out doesn't mean going crazy. Everyone has their way of going out, and find ways to de stress. Like, my second and third year, I started doing like marathon running and, things like that. Just find your own hobbies, make sure to don't lose yourself, and, you'll enjoy the process.
Okay, awesome. Thank you so much for such a great session. We really enjoyed it. We also got some really positive comments on it. We loved seeing all the cases, and thank you so much for your time tonight. And it's already